individualise the care. So we hear all...
I like the idea of the individual lifestyle checklist. I think that's something that's simple and would work very well in our practice. And I wanted to ask Claudia Leipert, who's a diabetes specialist.
The patients did not realize the gap in between the physicians and the patients. And to directly answer your questions, I think it is mandatory that the doctor have to warn the patient, especially in the initial visits. Like what Dr. Hanifa just mentioned, they can have myocardial infarction. For that reason, they have to tell them what sort of hypoglycemia, what are the symptoms, because they are not aware of this. They need it once to realize it, but sometimes I have seen patients who be having hypoglycemia and he thinks that it's his stomach. So it seems that there has to be a very clear education and also printing materials. In our center, this is completely done and intensively done by certain programs. We have a 5-day program. Every single patient, the moment he reports to our center, they have to stay on this 5-day program. They are taught about everything, and even they are taught about management. So if a physician doesn't have these facilities, I think it is his job to explain it simply and even to provide education material.
Such as, just putting the diabetes diagnosis into context, it's a challenging life event and it impacts the quality of life. The topic of communication is such a key one because the survey results highlight so strongly how there's a disconnect between what the patients feel is being talked about and what the physicians feel are being talked about.
The answers of the patients, so they recall being asked about a risky job in terms of getting a hypoglycemia. And when they are skipping meals, complication as long as chronic complications.
There is a disconnect between the physician's perceptions to be established. And the way to take this forward is to have an individualized approach in the management of patients. And I think that needs to be stressed. But I think at the same time, what this checklist also helps to do is to prioritize things. So when a patient goes to see his physician, he could decide that today I'm going to discuss working and efficiency. So this is a kind of a first thing, you know, and some of the findings are extremely interesting.
Questions about their daily life. So it's very individual, and from our diabetes educators' perspective, it has a lot to do with emotional empathy things.